Hello everyone and welcome. My name is Melissa Gallo and I work for Memorial Healthcare System in Southern Florida within the Process Improvement Department. The case I chose is called Understanding the Healthcare Communication Needs of Pediatric Patients Through the My CHATT Tool, a pilot study by Melissa Cusino, Kelly Ray, and Lauren Mednick. This case was written in the Journal of Communication in Healthcare on strategies, media, and engagement in global health. The topic of communication preferences within pediatric patients through technological tools is especially relevant for healthcare communications because the goal at hand is to break down communication barriers. In pediatric care specifically, providers are put in sensitive situations with patients who are also accompanied by parents who are diagnosed with chronic conditions, not sure of the best practices or patient preferences on effective communication throughout the relationship. Instead, these questions are asked through a user-friendly application to find out firsthand the patient's perceived value and preferred needs, to use as a basis for a tailored communication delivery method throughout the duration of the care. Providers are also often caught in sensitive situations of family dynamics when it comes to a pediatric patient and the impact it has more so on the parents. Therefore, they're also faced with how to effectively communicate and manage each different family dynamic appropriately. In addition to the family dynamics, health literacy also plays a role when communicating with the pediatric patient directly, along with building trust by displaying capabilities of empathetic communication. First, taking into account the setting of the pilot study, it was performed at Boston Children's Hospital where 22 pediatric subjects were compliant, ranging from the years 10 to 22. 4 of the patients were part of the patient focus groups, 5 parents participated in parent focus groups, and 9 multidisciplinary providers participated in live interviews. The study took place in 2 phases in which the patient and family participants were asked a series of questions based on communication delivery, their past experiences with communication, recommendations for communication, and My CHATT application-specific questions to understand the user side. As for providers involved, they were also interviewed, but on questions regarding using My CHATT and adopting results to cater to the care of the patient. Shocking results were revealed after the pediatric patients expressed that parents withhold information from them. There's a true desire of being informed of their diagnosis and treatment options and a need for personalized relationships with providers. Parents also made a point to mention a need for personalized encounters with providers, but voiced that direct communication between the provider and their child was uncomfortable. Participating physicians stated that there's a lack of comfort, standardization, and communication training for these situations, which leads to inappropriate and potentially offensive encounters. The My CHATT application was modified a few times in the pilot to reflect the feedback received from the subjects and common themes expressed. As a result, multiple choice questions cover communication categories such as which topics are preferred to be discussed and how much information, communication frequency, preferred name, and hobbies or favorite subjects. The case tells a clear story of the active evolution of the My CHATT application during the pilot study, which gives a thorough understanding of the problem and goal at hand. Luckily, it has become an easy-to-administer interactive tool made up of only 10 questions, taking into account the concerns and preferences from the patients and parents with nothing going unnoticed. Providers even found value in the addition of this tool, which shows complete buy-in on a clinical level. Although another strength of this case was that it took into account all sides of the equation, including feedback from the pediatric patients, parents, as well as providers, to gather the most authentic and non-biased data possible. Unfortunately, a weakness is that this pilot study was based on a frail number of only 22 pediatric patients. And of the small 4 who were part of the patient focus groups, 3 were identified as white and only 1 was Hispanic, which could potentially sway results from a cultural difference standpoint. Additionally, there is no significant prior research performed on this subject compared to only research regarding children diagnosed with terminal illnesses and data from the families that has been collected after the child's death. Similar to the small number of participants in patients, there were also only 9 providers who who data was collected from, which is not nearly enough when pulling data to get a true, accurate idea for buy-in of the application. I would have also liked to see the case go into more detail about the types of communication techniques that providers would be using to standardize and tailor the communication with patients and parents now that they have their preferences of specific topics given the My CHATT. I would like to task you all with a few wrap-up questions for further analyzation of this case, which include: what role do you think culture and cultural competence play on the results of this study? If My CHATT were to continue pilot study sessions to gather more pediatric data, what type of geographic location should they focus on next and why? What other healthcare setting could My CHATT also be effective for? How would you further modify this My CHATT tool geared for your organization or any organization in general? And finally, since many of these patients are under the age of 18, accompanied by an adult, which makes them minors, should these interviews and My CHATT pilot be done with such young patients or only limited to their parents? In conclusion, since this has been the only form of data gathered directly from pediatric patients regarding preferred ways of communication during their care, it is important that more of these pilot studies are done, but in larger numbers, to fully understand trends of patients and their parents to take the next steps in this sensitive subject of effective communication. The number of providers included should also be increased to find what the true perceived value is of using this type of tool for more effective communication. If providers do not see value in it, then it could potentially be a waste of time for the patients and parents, and no personalized encounters or relationships will be engaged. Thank you so much for your time, and I look forward to hearing your ideas and discussing further with you on this topic of pediatric communication preferences.